Good morning everyone. Myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about nature and importance of biomechanics and sports physiotherapy. So basically biomechanics is made up of two words, namely bio, which means life, and mechanic means forces and effects. So it uses physics and engineering concepts to describe motion undergone by the various body segments and forces acting on these body parts during normal activities. So the interrelationship of force and motion is important and must be understood if rational treatment programs are to be applied to the musculoskeletal disorders. So it is the study of structure and function of biological system by means of method of mechanics, and it was developed in the early 1970s, which describes the application of this engineering mechanics to biological and medical system. So what are the components of biomechanics? So basically we are having the static and dynamic components. Static means constant state of motion, dynamic acceleration is present. So kinetic of motionless system, constant velocity system. Then this constant velocity system is further divided into kinematics and kinetics, and dynamics further divided into kinematics and kinetics. So statics refers to situations where the body or object remains at rest or is moving at a constant speed in a state of equilibrium. Dynamic deal with the changes in motion brought on by the unbalanced forces. So basically the major branches where the mechanics is used, like in this figure it is shown. So rigid biomechanics, static and dynamic, then dynamic further divided into kinematics and kinetics as it is shown in this figure also. Then kinematics describe the motion without regard to the forces producing it, and kinematic variables include type of motion, location, direction of motion, and magnitude of the motion. Then in kinetics, it is concerned with forces producing the motion. Kinetic variables are force, inertia, acceleration, momentum, and friction. So where are the, or we can say what are the areas of study? So we are having clinical and sports biomechanics. And so sports biomechanics analyze the professional athletes and sports activities. So basically there is a physics of sports which we study, and it is as most optimal way to move the body to achieve maximum performance whilst minimize the risk of injury. So what is the importance of this biomechanics? So description of prescribed movement, expert performance is analyzed and then explained to learners. Correction of faulty techniques in sports and analysis of performance can be made available. Or there is also a better assessment, like body mass is necessity in football and hindrance in gymnastics. In football requires more strength in leg, whereas gymnast in arms. So next, prevention of injuries, and biomechanics knowledge also enable the physiotherapists making that diagnosis accurately, so that they can plan the treatment accordingly. Then also there is enhancement of sports performance, because according to biomechanical principle, it increases the duration of application, thereby increasing the velocity of flow. So also adjusting equipment, clothing, apparatus, crowns, and other factors. Implementation of knowledge in ergometrics, like force platform, motion analyzer, treadmill, etc. They both are used for diagnostic as well as for the rehabilitation purposes. Then there is also a usage in the special sports, like in the para athletes also. Standardization, which is basically achieved in sports analysis, understand the fundamentals of defining the joint movement anatomically, and also we can describe it from the video observation, some simple sport and exercise movements like walking, running, jumping, and appreciate why breaking these movements down into phases can help simplifying the description and later analysis. There are some other important considerations, like the principle of statics have applied to manage the nature of forces system, also utilized for motion description, gait analysis, segmental motion analysis. Then we are having the contribution in research also. So research activities can be divided into three areas, like experimental, model analysis, and applied research. And definitely it will benefit the human being, and in case of musculoskeletal injury or illness, it is one of the primary occupational hazard in the industrialized countries. So how our muscular system adjusts to common work conditions. So we can develop the guidelines to ensure that manual work conforms more closely to physical limitations of the human body and also the natural body, so that injuries can be combated. Thank you.